can see us and hear us.
Hello, I think we're live now. Welcome, this is Bicester Midwives. Just wondered if anybody could just give us a thumbs up to let us know that you can hear us and see us. That would be great. I'm Melanie, I'm one of the Bicester Community Midwives, and we've got Trudy.
Hello.
And we've got Sam.
Hello.
Sam has with her George, who's one of our babies that we use for demonstrating purposes. So, can you turn the sound down? Sorry. No, it's not on here, it's just on
We've
your
got a
mobile.
thumbs up from Nicola to say that we're on.
Thank you. Sorry, just a bit of a technical issue. We've got phones here and we didn't want to hear it on their phones. So, anyway, thank you and welcome. We are going to talk to you all things postnatal this afternoon. So, fire away with your questions if you have any for us. Sam will pick up on the questions for us and we'll just try and talk you through. So I think I'll just start by sort of giving you the initial welcome. Once you've had your baby, very many congratulations. And when you come home, so you'll be discharged from hospital. It'll be different for different people, obviously. There will be a bit of a longer stay for women who have potentially a caesarean section or any post complications for either yourself or your baby. But the discharge procedure is exactly the same. On the day you come home from hospital, your hospital midwife will inform you that your community midwife will be in touch the next day. So the hospital let us know that you've been discharged and we will then give you a phone call and we'll see where you're at with your stage of postnatal care. More likely than not, we'll try and see you on that same day. And whether that be in our offices at Bucknell, if everything's all okay and nice and normal. However, if you struggle to get to us, either because you've had caesarean section or no transport or just finding it very difficult, then we will come to you. Obviously, during this uncertain time of COVID and protection, the opportunity to attend to see us proves far greater protection for both us and yourselves, but we will, as I say, always come to see you if necessary, wearing our full PPE equipment.
It may be worth just adding here that before you go out of the hospital, you just check with the midwife that she's got your current address, or if you're going to your mother's house or something like that, then we've got the address that you're actually staying at, and just touch base with the telephone number that you'd like us to call you on.
Very useful information.
Yes, that's a good idea.
Okay. So we will then, as I say, usually see you on that first day or speak to you. You'll have some contact and we'll arrange a pathway according to that. So for those of you that haven't already been to Bucknell or don't know Bucknell, that's where we're based. As our primary base as Bicester Midwives, for a lot of you antenatally, you'll know that we've been here at Ambrosden now for some time, and the Ulchester and the Bicester Health Centre midwives still run out of Ambrosden surgery as well. But as I say, for all postnatal contacts, we usually use our Bucknell surgery. So, routine postnatal care then. The next scheduled day that we would actually like to see you or see you and your baby for anything is on our day 5. And on day 5 we do a newborn blood spot and we weigh your baby. So Sam maybe want to tell us a little bit about day 5s, because Sam supports us in the community with doing our day 5s, with weighing babies, with breastfeeding support. Sam does absolutely everything, other than specific clinical midwifery skills, which potentially really is only not being able to check a woman's stitches. So, but she pretty much does everything for us as well. So I'll let Sam talk about the day 5.
Thank you. Can I briefly say about the care plan?
Yeah, the care plan first. Yeah, that's good, and then we'll go on to that. Yeah, that's a good idea.
You'll go out of hospital with a care plan. It's got and lots of leaflets. But this care plan is what we write in when we come and visit you. It's also really important when you leave the hospital. It's got the telephone numbers on the front. So if you have worries about your baby's feeding or you're bleeding a little bit too much or something, then you can call these numbers. There isn't really a most important number. You've got maternity assessment unit down here that you can call, but also whoever, if you're with Bicester Midwives, then Bicester Midwives only has a 9 to 5 telephone number, so you may want to call Wallingford Midwives, who oversee all the telephone calls out of hours, so it's just worth bearing that in mind.
Mm-hmm. You, as you said, your blue notes will get kept in the hospital, so just double check those before you go into hospital to make sure you haven't collected your scan pictures in there, because the hospital won't get those back for you just to get your scan pictures back. So make sure that everything's personal to you is taken out of those blue notes. So yeah, I'm going to talk to you about what happens on the day 5. So when you come in for your day 5, you may well see me or one of the midwives. We would ask mum and baby to come into our room at Bucknell. What we will go through is a series of questions with you, which are all in this sort of care plan here. Be my assistant. So we're just checking really for you, just to make sure that you're okay and that you're not bleeding too heavily and any swelling. Obviously all those things you do need to let us know about. Also for babies, so we're just checking a series of questions for babies, so how they're feeding, wet, dirty nappies, because that gives us a really good idea of how well your baby's feeding, especially if you are breastfeeding. So we will weigh your baby. We do always expect a weight loss on day 5, and we will work that out for you. And that will go all depending on what weight loss your baby has got. We will do it for the future plans, really, and how often we weigh your baby after that. We also offer you a newborn blood spot test on your baby, which hopefully you've all had one of these screening booklets. And in the back of the screening booklet is all about the newborn blood spots. You can get this information online as well, so if you want to have a little read through of it before you've had your baby, so at least you know what you're consenting to. Because with any of these tests, we do need your consent. We do need you to say that you're happy to give this. So this is like, they used to be called the heel prick test, the PKU back in the olden days, but it's now called the newborn blood spot test. So we need to take a little bit of blood from your baby's heel, okay? And the best way for us to do that is to get your baby to feed. So I'm going to pass. Oh, actually, do you want me to read? Yeah, Mel won't hold George. So I'm going to hold George, and Mel is going to just show you how we demonstrate doing a blood spot. So just bear with me.
Okay, so your midwife will have the lancet, which is what we use to just, it just takes a tiny little nick into the baby's heel. The baby's heel is where we can get the best supply of blood just for these little spots of blood that we need to get. So what we'll do first is we will use some warm cotton wool, and we'll just rub the baby's foot just to clean it, but also being warm, it stimulates the amount of the blood flow, sorry. Okay, so we've done that. As you can see, Sam's holding the baby with the foot here. We can take it from either side of the heel of the foot, and whichever way is easiest. Now, we work with you rather than you working with us. So if your baby is being breastfed, we do suggest that you pop your baby on for a breastfeed, because we know that by breastfeeding that can release some natural pain relief and make it sort of slightly less traumatic for baby. Now we have to remember as well that babies don't particularly like this, and what they don't like more than anything is not actually the heel prick itself, but then the fact that we hold their legs and restrain them, so they can get a little bit upset. But by breastfeeding, that really helps. I mean, you could also offer a bottle at the same time. So we've cleaned the foot, and then as I say, we've got this lancet, which we just load by pressing it, and then we press it against the baby's heel, and just, I don't know if you'll be able to hear the sound effect, but it just makes a noise. Just a little snap like that, okay? So George is a really good boy, and he's going to stay. And then what will happen is, we just allow nature to take its course. So with the foot flowing like this, you've got gravity, alright? And we allow the blood to drip from the heel. We've got 4 spots on the end of this card that ideally we want to fill these spots. Now, if you're anything like me, I've either got a shaky hand or the baby's kicking, and I never fit in any of the spots. I get it everywhere. So as long as you get 4 good blood spots, and we're just going to allow baby's heel to drop and let the blood drip onto this card, okay? So we want to have 4 good spots, because we don't want the labs to then just say, sorry, we need to come back and do it again. Once we've finished, we're just going to wipe baby's foot again, clear up any mess, and we do have just little spot plasters that we'll pop onto baby. Those plasters don't have to stay on just an hour or so, it's just to keep all clothing clean, and then you can remove it yourself. So, and then we send off the blood spot card. Thank you, George.
It's very good. It's very well behaved, baby.
We just have to make sure that we've got all the information correct on here to send off to the lab. So we'll just double check how baby's feeding. If you have got any family history of any of the diseases that we're testing for, then we'd like you to let us know. We need to make sure that we've got your correct telephone number. And if the baby doesn't have the same surname as yourself, then we would like baby's alternative surname. Okay? So that is the little heel prick test.
So also on day 5 is obviously a really good time if we haven't spoken to you before about some breastfeeding support. If we feel that we need to do that with you for the plans that we go ahead for you and your baby. We don't have an awful lot of time at our Bucknell office, but we can sort of maybe arrange to come and see you at home if we feel that that's more important the next day, or even sit out in our little waiting area and do some breastfeeding support with you if you want some extra help. Okay, yeah, and I think that's probably about it. Yeah. We may well check your baby's jaundice levels. So if your baby looks a little bit yellow, that is very, very normal for your baby to look yellow. It's a normal process that a newborn baby has to go through. But sometimes they do get a little bit too yellow and they get a little bit sleepy. So if ever you're worried about your baby's colour or you're worried about your baby being a little bit too overly sleepy, then please let us know because we can do a test, and that is before day 5 as well. I'm just going to hold. I wouldn't hold a baby like this normally, but I'm going to hold it so you can see what Mel's about to do.
So this is what we call a transcutaneous billimeter, a TCB, and it basically measures the baby's jaundice levels by refraction of the skin. So it's got the transcutaneous is the end bit of it, and once we turn it on, we will place it a bit. So it's non-invasive. It doesn't hurt. Doesn't do anything, and we'll just place it on the top of the baby's chest here. And we take, the machine takes an average of 3 readings, and it just makes a little sort of bright light 3 times. And George comes up with an error, surprisingly enough.
Oh dear, George.
But we have different levels for different stages or different ages of baby's life. That's something we taught you as and when, if your baby was to have a jaundice problem. Sometimes it does require us to take Sometimes it takes us, we are required to take a further blood test just to monitor baby's jaundice levels, depending on what the results are on that monitor. But the monitor usually helps us to keep an eye on things with jaundice. So I think we've covered all the baby stuff at day 5. Trudy,
I would say just ways to avoid jaundice is actually feeding your baby up as much as you possibly can. We do hear some people are really, really grateful for having well-behaved babies, and that makes us a bit worried because those babies are generally sleeping a bit too much. So any topping up that you can do of expressed colostrum in those really early days, even though you need a break, baby is programmed to want lots of feeds, and if he does go a little bit sleepy, then you're going to help the jaundice out and baby's weight loss out by just increasing those feeds as much as you can. So the baby will wee all that bilirubin out, and sunlight will help a little bit depending on what research you look at. But any tiniest amount of jaundice before day 5, then we want to know about it. So this is definitely a thing that you should phone us and say that you're a bit concerned about your baby's colour. We're going to want to see the baby because it's really difficult to explain the colour over the phone, and we'll do that billy check, which is reasonably accurate as long as the jaundice level isn't too high. So do feel that you can phone us. Now our telephones are really busy, especially in the morning, because a lot of our consultations are done over the phone now. But do persevere, and you can call Maternity Assessment Unit. They're really busy too, but at least they've got somebody there who can pick up the phone. So if you're at all worried about your baby's sleepiness, about the colour, then make sure that you speak to somebody about it.
With that, just from a Bicester Midwives point of view as well, and contacts, that just leads me on to say that for those of you that do know, Bicester Midwives have got their own Facebook page. We are unfortunately unable to answer any questions through Messenger, and we, like Trudy said, we do appreciate our lines are really, really busy. However, please, anything that you want, please just, like Trudy said, use the phone, we use maternity assessment. As I say, we can't answer any questions on Facebook Messenger, sorry. Thank you.
Has anybody got any questions? Please fire them away if you have.
If I just talk through the care plan as well quickly,
Yeah.
which is, we mentioned the care plan earlier, so contact numbers on the front. On the next page, the hospital midwives will fill in, and it just gives us a little bit more information about yourself and your baby, okay? So that's good for us to know when you come out into the community. There's a place here to record when we do the baby's newborn blood spot. Your baby will also be offered what we call a newborn infant physical examination. We call it NIPE for short. That examination needs to be carried out within 72 hours of your baby being born. Now, for those of you that might stay in hospital for a day or two, we have NIPE midwives in the hospital. That includes some of your community midwives. We come in and do it on a rotational basis. If you come out earlier and you haven't had your NIPE check done, there are 3 Bicester midwives that are qualified to do the NIPE check in the community. Failing that, worst case scenario is that the GPs can also perform this examination. So the examination is designed to give your baby a full-on top-to-toe check, primarily focusing on the eyes, the heart, the hips, everything else that's in between, get a family history, any referrals that need to be made, and we just make sure your baby's been examined thoroughly. Your baby is constantly changing, and all the systems in baby is changing from being in the uterus to being outside in life, and these change over a period of weeks. So you will get another examination like that with the GP at around about 6 to 8 weeks. So we can record the blood spot, we can record the NIPE check, any blood results that we need to put down there, and also lets us know about your perineum as well, because we focus quite a bit on baby at the moment. So perhaps when I've just gone through this, Trudy can talk a little bit about your as a woman, your postnatal care.
Your perineum.
Your perineum, Trudy. So we have 2 records here, one for mum and one for baby. So the things that we'll check, as I say, and we'll go through mum in a minute. But for baby, we are going to note down. We've talked about colour, so for the jaundice. And the eyes are a good recognition. Again, jaundice might show up in the white of the eyes, but it's also just good to know whether the eyes are sticky, clear, or anything like that. We'll also document that we've checked your baby's cord, so that's another thing that perhaps Sam can talk about baby's cord and what to expect. We also want to know what your baby's output is, so we'd expect to see your baby stooling and the stools changing. And also we'd expect to see your baby weeing on several occasions as the days progress. Feeding. Then we go on and we've got an area where we can put a feeding plan in place if we need to, so it can all be documented in here. Documented that we've shown you how to hand express if you're breastfeeding and that's necessary. And what else? Let me have a look. Next page. If you are a breastfeeding mummy, then there's a checklist in here that we use, which is, it was designed initially for the health professional so that we can check that your baby is responding to the appropriate feeding with regards to breastfeeding, but it's also really good for you as mums and parents to actually have a look to see what your expectations of your baby's sort of stooling and urinating and baby's behaviour and how many types of feeds you should have. The green answers are the good answers, and the yellow answers are maybe something that we need to work on and put a plan in place. And then we've just got pages for notes. So, say before we move on to perhaps mum's postnatal care, I'll just get Sam to have a quick word about the cord. Also, there's a detachable page on the back, which is really, really good because you can take it and keep it, because it tells you what to expect for you and your baby in the first 24 hours, and then what to expect from you and your baby from then onwards till 12 weeks of age. So there we go. So Sam, you wouldn't mind talking about the cord?
So when your baby is born, obviously the umbilical cord is going to be cut, and that may well be what daddy or any partners do cut, and they will put a clamp on your baby's cord, and that will be left on your baby's tummy. Now over the course of the sort of few days, that cord is going to really dry out, so it's going to be quite sort of sticky and sort of gooey to begin with, and then over the days it will get quite dry. It almost sort of dries out looking like a great big scab, and I know that sounds really, really awful, but it's not as awful as it sounds. It isn't a parent's best thing on their baby, and a lot of parents are quite, oh, I don't want to touch it, I don't want to look at it. But every time you do a nappy change, if you could just keep a lookout on it for us. It should be looking quite clean and dry, okay, around the the cord drying out. The tummy shouldn't have any redness to it, and there shouldn't be any goo or any. Are we still on?
Yeah.
Yeah. We shouldn't have any sort of oozing or gooiness. Now, cords can take a little time to come off. Some are very quick, but some can take a little time to come off. And as they do start to separate, it can look a little bit gooey and a little bit sort of yellow underneath. And as long as there's not like a really hideous smell, like a really awful smell, then that's a really good sign that there's no infection brewing on the baby's cord. If you're ever really worried, so it is really gooey, there's blood coming out, even just little bits, and that is got a really horrendous smell, then you would need to give us a buzz. We can always then have a look at it for you, and then sometimes we do get you to pop along to the GP and get some cream, some antibiotic cream. Unfortunately, because of where it is, babies do wee and poo, and sometimes all over themselves when you go to change their nappies. So it is a place that can sometimes get infected. But otherwise, just keep it, making sure it's clean, but leaving it well alone is the best thing, and that will dry up really, really quickly then, hopefully, and then fall off. And one day you will find just the cord and the clamp probably in the foot of the baby grow, and then you can keep it if you want to, or you can throw it away, whichever you would prefer to do. Some people keep it in their little keepsake box, some people are quite happy just to pop it in the bin, which is entirely up to you. When we see you, every time we see you, we always check baby's cord and then check their tummy as well once the cords come off. So it is something that we do keep an eye on for you as well. Any questions, please let us know.
Babies do sometimes get a bit of a rash as well, don't they?
Yeah, they can get a bit rashy.
So this is a natural response to the bugs and things that babies get outside of the womb, because you've made all the antibodies for baby up until now. So these occasional spots around their body, if you look at them, they probably actually move place every few hours, and they'll come and they'll go. If there's a big rash, then always call us and we'll discuss it with you. That rash might need checking, but we don't encourage you to bath your baby so much nowadays. And these rashes, if there's a little spot in a sweaty place like under their arm, then it can get quite sore and possibly infected. So a couple of times a day, you're going to be checking the groin area more than a couple of times a day.
So George's not got
over the arms and hand the neck where baby might vomit and get a bit of milk. Then just check for those spots that they don't become infected. What else was I going to say?
Well, nappy, rashes, they can get quite rashes on their bottom as well, so like nappy rash. Now, again, it can sometimes just be a normal process that they go through, but if you do find that your baby's bottom is quite red or quite sort of angry looking, then if you just use a very small amount of like a nappy rash cream and apply it to the affected area, and then each nappy change, just wiping that off and reapplying until that's healed up. Some babies get it more than others, so it's not something that you can always guarantee your baby's going to get, but just keep an eye out for their little bottoms.
But don't use the nappy cream unless you think you've got a problem, because a lot of people, and it's marketed as nappy cream, nappy rash cream, so a lot of people will put it on from day one, and it is a barrier cream, so if you put it on, you're then not allowing anything to get to baby's bottom, especially air. So it's only to be used very, very sparingly, and only if baby has a rash on its bottom. So yeah, okay.
I think that's.
And chance of COVID as well. Yeah. Handing baby to grandmas. Now, we do hear little stories of, oh, I won't hug you because of COVID, but actually I'd quite like to cuddle your baby. You know, babies are as vulnerable as anybody else is, and actually you do need to be protecting them. So this baby will still be a baby in 4 weeks' time. Don't feel, if you're, be that protective parent, and if somebody does want to get their hands on your baby, just tell them to wait. It will wait. Yeah.
If you've looked after yourself and protected yourself from COVID all the time you've been pregnant with your baby on the inside, then it's no different once baby has actually arrived, and you've got the joy of all these live social media and all these sorts of things you can now video with your baby. So. But yeah, COVID is a very important factor with a newborn.
They have a question, Jodie, from Emma. Hello, Emma. I think I saw you at one of your visits.
Don't read it out to us, Trudy. Unless you want to talk, and I'll just get the gist of this.
No, just read it out to us, then we can answer it.
Okay. Hi, ladies. Do you have any tips on how to treat milk bulbs, please? I'm not sure what a milk bulb is. I've had one appear overnight. It's a bit painful. Also, whether you're exclusively breastfeeding, should a baby's poo remain green, yellow in colour until they go into solids? Could I also say a massive thank you to all Bicester Midwives?
Oh, that's nice. Thank you.
Myself and baby Alfie, 3 weeks today, have had a really good care by Bicester Midwives during my pregnancy and after, so thank you. Special thanks to Laura, Lily and Sam.
Oh,
You looked
thank
after us really well, Sam. Thank you for all your help and support in my breastfeeding. Alfie has got a tongue tie, which has been corrected today.
Oh, bless
Well done, Alfie.
him.
Seems to be a happier baby already.
Oh, brilliant.
Okay, so milk.
I was just going to say that I don't think we should touch on the breastfeeding and stuff here because obviously we've got the separate breastfeeding chats that are done by the infant feeding team.
Absolutely, we can comment on the baby's poo.
Yeah,
Yeah.
absolutely.
Yep, so when a baby poos initially, that first day, it's going to be black and tarry, sticky. And this is all the cells and the liquid that the baby has swallowed in utero and it's built up. So that's when babies poo, it's called meconium. And the quicker we get that out of the baby's body, the better. Colostrum will help that baby poo out. So the quicker the black poo is disappearing and actually greeny, browny poo is coming in, then the better the feeding's going. And ideally, by the time we get baby on the scales and we see baby on day 5, then that poo should be at least mostly yellow. There are reasons why some babies may have a green poo, and that's always something that you should chase up. It could be, looking at Alfie's history, it could be that bit of tongue tie, where baby's been a bit windy, been a little bit upset with its feeding, and it'll be interesting to see whether that changes now. Okay, I hope that's answered.
And I think Emma's got details for the HAB visitors and Sally, so if that doesn't rectify Emma, then give them a buzz, and that would be great.
Thank you for your
Thank
feedback,
you,
Emma.
thank you very much, Emma. Really nice to hear from you. So yes, I was just thinking, we did nappy rash, and then I was thinking baby's eyes. So when your baby's born, obviously there's something again, like Mel said, we check their eyes for jaundice. We're also just making sure they're not getting overly sticky or like stuck together. So if you find that your baby is getting quite sticky eyes and they're struggling to sort of open them, the best way is to give them a little bit of a clean. And now breast milk is amazing for cleaning your baby's eyes, and also some cold boiled water, okay? And it is just giving your baby, getting some cotton wool and just giving it a wipe from the sort of insides of downwards and trying to clear the sort of stickiness out of their eyes. If you keep doing it, it's getting worse, it's getting really sticky, there's sort of green gunky stuff coming out of their eyes. You would need to contact the GP in case they've got a little bit of conjunctivitis. Then they'll prescribe some drops for you. But again, we can help you and advise you on that if that happens.
Lovely. So do you think we've covered everything they'd like to know about babies?
One little thing, just really briefly, because it doesn't happen very often, is sometimes babies have lumps on their head. So if it's a forceps delivery, or your baby's actually been bashing against that pelvic floor for quite a long time with a normal delivery, babies can have either little fluid bubbles on their head, or they can have hard lumps where maybe there's a bit of bruising, or sometimes it's just a uniqueness to baby. If you notice any of those that haven't been looked at already, then do be in touch with us. It may just be a matter of monitoring, and these often go down without having to do anything, but it's one of those times, especially if we do go into another lockdown, then do feel like you can phone with any of these issues. Don't sit at home and worry about it thinking actually the world's going to pieces and I won't bother the midwives about it. We want to know about it.
Yeah, absolutely.
And we are here, well, as midwives, we are here 24/7, 7 days a week. Our phone lines might not be able to answer you that, but like we said, Bicester Midwives are 9 to 5 with an answer phone. If your queries are more urgent, then you phone maternity assessment unit or you phone the Wallingford telephone number. Wallingford are a triage service, so they can always contact a midwife on call, and that'll be a Bicester Midwife on call that then contact you back. So, do we have another question?
No, it was Louise.
Oh, okay.
Hello, Louise.
Hello, Louise.
That's our team lead.
So I think moving on then, just fine with baby, we usually discharge you and baby around about day 10, okay, but our remit will allow us to look after you until you're 28 days postnatal. So on some occasions, whether it be feeding, jaundice or weight, sometimes we do keep you on that extra little bit longer. But most of the time, any time between sort of 10 to 14 days, we'll discharge you, and that results in us getting another weight from baby, and we would expect baby's weight to have reached back to its birth weight if it hasn't already. We just need to make sure that you've had that NIPE check that we talked about earlier. Make sure that your baby's had a hearing screen. So in hospital, ideally the hearing screen ladies will come around and check your hearing. If not, they will provide you with an outpatient's appointment in your local community area. We double check that you've had the little newborn blood spot done on day 5, and also registering of your baby's birth. Now, they have well and truly caught up from our lockdown for registering births, so there is a registrar in the John Radcliffe Hospital, but she's very hit and miss with the times that you might be able to actually get hold of her. So most of the time it will be done. And I don't know if anybody knows, but Bicester Registry Office hadn't reopened.
It hadn't, last I heard it hasn't.
So,
No.
yeah, so you are still having to go out with Bicester to registrars to get your baby's birth registered. So I think we've covered baby postnatal, really, haven't we? So,
unless you've got a question.
unless you've got any
please ask us.
questions. But also, obviously, we're looking after you postnatally. So, as I say, Trudy will stuff.
Yeah, looking after your perineum. So, having had a baby, I think everybody is going to have a certain amount of bruising. You know, that tissue is fantastic, but it does take a bit of a bashing to get that baby out. And some people might need a bit of a hand with an episiotomy, and some people may have a natural tear as the baby's come out a little bit quick, or maybe with its hand up by its head or something, then you've ended up with a bit of a tear that needs some stitches. Those stitches ideally don't become infected. It's going to be sore whether you have stitches or not, but stitches are going to make you very sore for a couple of days, so you probably will need painkillers. You'll then start to be a little bit more active, and we'd expect you to be, you know, moving around reasonably, albeit a little bit slowly. I would recommend having some comfy trousers on. Don't try and get into your jeans just yet. Go up the stairs once for 10 things rather than going up 10 times, because that friction isn't going to benefit those stitches at all. I'm a one for recommending baths. I think showers can either not get to the point that matters, or it can be a little bit too invasive. So I think 3 or 4 inches of just water in a bath and swell your bottom to clean it a couple of times a day is really, really useful. I think you're going to get cleaner that way. If you've got a girlfriend that wants to give you a little gift, then essential oil of lavender or chamomile will, it promotes the healing. So you don't really need antiseptic if the area isn't septic, but you do need to promote that healing. So the essential oils, either in a squeezy Lucozade bottle as you pee, or as I say, in the bath. Pelvic floor exercises, don't we all just love pelvic floor exercises? It's really, you know, your pelvic floor is a little bit blown away at the moment. But if you do some squeezing, that's going to bring some fresh blood that will get rid of that bruising, and the healing will happen. The oxygenated blood will heal that wound much, much quicker. Temporarily, you can put a wet sanitary pad in the freezer, and you can add a bit of lavender to that as well. It will delay the healing a little bit, so no more than 20 minutes, but that can be quite a relief at the end of the day if you're feeling a bit sore. Don't put it directly against your skin, but that will bring a little bit of relief. We will always check your perineum if you'd like us to check it. We can see if there's a little bit of breakdown with infection there. Sometimes you're feeling very sore from maybe a little bit of a blood blister inside, and we can't actually see that you know, we can see that the stitching is healing well, but you've still got some pain, and that may just take a little bit of time to go, but it can be reassuring to have us look. So we'll always ask, and you can say yay or nay. As with everything antenatally, we only offer stuff, and we can back that offer up with the benefits that it might bring, but it's your call. You know, if you feel like you've had enough faff with that area and you're feeling like it's healing well, then you're the one that we should trust with that information. If you get an infection, then that area is obviously going to get an awful lot sorer. It will get swollen. It will pulse probably because of the angry blood that's going around it. It may, that the loss that you get might become a little bit offensive smelling, and you may feel really quite unwell. So any of those symptoms, your partner might notice you sitting on the sofa a little bit slower. That's the time, we know that we're going to have a painful bottle when we've just had a baby, but how painful should it be? That's a really difficult one, so do talk to us if you feel like you need some support with that. It may be that we need to get some antibiotics for you.
Good. And then I guess in conjunction with that, we talk about the fact that postnatally, after you've had a baby, that you will bleed. Okay, so I'm sure you'll all be aware of it, and it's a bleeding called lochia. It's basically the lining of the uterus whereby your placenta is attached to obviously inside your uterus, and as that's come away, I look at it as sort of forming a big wound that needs to heal, and so the lining comes away as the scab sort of comes away. So yes, you will bleed quite heavily in the first few days after having a baby. So it's really recommended that you buy maternity sanitary wear. Don't just think you'll be able to get away with an extra large sanitary towel. They won't cut it. Okay, so it's more than a heavy period, and that the heaviness is probably good for a good 5 to 7 days. It will start to tail off as it becomes older. It will turn into sort of a brownish, and then just into sort of a gooey discharge. But your body does take, everything to do with your body takes an initial sort of good 6 weeks to heal fully. It takes your body a whole year to recover from having a baby. But a good 6 weeks, and you have the potential to bleed for up to 6 weeks, as I say. And it may come and go. May come and go with breastfeeding, because the hormones that you use to breastfeed are the same hormones that contract your uterus. And that's another thing we do, put a hand on your tummy just to feel that your uterus is contracting well. So you might just think that everything's cleared up and you'll have a big breastfeeding session, or you've not been out to the shops for days and all of a sudden you go and do a mad Tesco's dash, your bleeding might just come back a little bit heavier. So just always be aware and always be alert of that. So
I do have a question from Sharon.
Yeah.
Sharon wants to know where the Bicester mums can get their babies weighed after we've discharged them. Well, or Sharon,
tricky
that's a
one.
health visitor issue probably, and so when we discharge you, we make sure there's an overlap between ourselves and the health visitors, so they have all the information about your baby. If there's been a worry with the weight loss, or there's been a medical condition picked up, then the health visitors will be working with you to make sure that the baby is okay going forward. And there's less emphasis put nowadays on healthy babies being weighed regularly, but that answer will come from the health visitors. You'll have the telephone number, and they're very, very accessible.
Yeah. I think we do know in Bicester at the moment that there is nowhere to go.
No,
The health
not
visitors are
venue.
not providing any services or venues for you to go and weigh your baby. As Trudy said, if there are any health issues, I believe that some health visitors will come to your house, so to speak, and weigh your baby sort of in the hallway.
Yeah.
But unfortunately, weighing at the moment from a health visitor service is very limited. So, but your health visitor would reassure you and advise you of all the situation once we've just handed that discharge over to you. Okay.
Yeah. Did we show that then?
No, didn't say that before.
So when you come out of hospital, obviously you'll get your care plan, which we showed you, but you'll also get a red book, okay? And this is what every child has after they're born, and this will come home with you from the hospital. So we need you to bring this with you to your appointments as well, okay? So we need to document baby's weight, the blood spot, we will document in there as well. This then will go on and be used by the health visitors, okay? And all their immunisations and everything are actually documented in there. Lots of useful information as well, and there's even sort of sections at the back where you can put baby's first smile and things like that. So this is something you keep, whereas the care plan will come back to us like the blue notes. This is something you do keep for as long as you want to keep it for, and pass it on to them when they go to university if you want to, but that'll be your red book that we will ask you for. And you can, as I say, in the back there's quite a lot of things that you can do yourself as well. So that's what you come home with as well.
I think it's really important as well just to touch on depression for all you lovely ladies. Obviously it's quite a taboo subject, but obviously for us in maternity it's one of the things that we think of first and foremost, also antenatally as well as postnatally, and it's very important, as for some of you that may have helped to let us help you with the antenatal period. Obviously the postnatal period is just as if not much important, because your hormones start to become affected even more so once you've had the baby. You may have heard of the so-called baby blues on day 5. That's when your hormones take a little bit of a drop. But you'll know that because it will be a question of you're crying but you're happy, and it's not a question of not being able to control your hormones. But there may be times when you're feeling really, really sad, and you just don't know what to do, or things just get too much. So we do have a leaflet. Obviously during COVID we've not been handing out leaflets quite so much, but there is the information available to you. It's really useful that your partner, family, anybody that knows you normally would be able to recognise any signs to let us know, or ask for them to tell you to let us know. We can provide you with the support, whether it just be, again, during these times of COVID, we can't offer you a shoulder to cry on literally, but we are there to support you. We have a fantastic maternity mental health team around us within the hospital, and we don't want anybody to go unnoticed or unmissed. The same goes for partners that are struggling. Postnatal depression does get missed for men, but it is a recognised thing. So again, don't be shy. Please ask for support if you think that they need support as well, or if they want to ask us as well. So please don't be afraid to ask for any help if you're feeling a little bit low, and we can reassure you and get you any help that you might need. Okay, so I think we've got another question.
Yeah, we have it.
I was going to chat about birth trauma. I'll do that in a minute. So Louise has messaged in about actually what to expect from the contact from health visitors. They will often see you antenatally, and give you a bit of a rough idea about what's going to happen. We expect them, I think, to see you within the week after we've discharged you. Now that's seeing you, maybe a phone call, it may be a video call, and I sort of see the health visitors as a fluffy healthcare, without giving any disrespect to the health visitors. If you want some support, some reassurance, have a question about the general well-being of baby, then health visitors are really good. They'll also help with some feeding issues. If it's a proper health issue, then obviously see your GP, but there's quite a lot of overlap between what the health visitor and what the GP can do, and actually, until we discharge you, what we and the health visitors do. So I think phone them if you have any questions, phone them, and they will explain, in relation to where we are with COVID, what they can offer you, where you can get support. It may be that the health visitors just are able to direct you somewhere to get that support.
I think she says her baby's 8 weeks, so it's important to contact the health visitor if you haven't heard from them and you haven't had your baby's immunisations, because that is something that they do sort out for you, or guide you through on how to get that done. So if you haven't had the immunisations done and you need to speak to our visitor, like Trudy said, please give them a call, just so they I've got you in the system.
And also to be aware that health visitors operate 9 to 5 Monday to Friday, so if you do have any dire health issues with your baby, then it's important obviously that you phone out of hours or A&E, whichever you think is most appropriate. So,
going back to birth trauma and depression after having your baby, so we all want that lovely birth, with the candles and the water, and sometimes birth isn't like that, and some people will need some debriefing. Some people will have some post-traumatic stress disorder. So if you're having flashbacks, if you're not able to sleep at night, if you're waking up fearful, or your partner, then there's a birth afterthought service. I'm going to give you the telephone number. It's 01865 220 605. And for anybody that has had an instrumental birth cesarean section that they weren't expecting, you should actually have a little leaflet about that, and there should be somebody available to speak to you, about what happened. So that's an option for later in the first year of the baby's life, or when you're pregnant again and some of these issues rear their little heads again and we need to address them then. So have a thought on that one.
And we've got another question from Charlotte, thank you. So Charlotte has asked, well, she says it kind of feels like her newborn has teeth. She latches well, but it hurts at times. Is there a cream that you'd recommend for this?
For a nipple cream,
Well, obviously there are nipple creams, aren't there? But I don't know if...
it sounds more like it's a latch problem.
Yeah.
Because babies do get teeth and they still very happily breastfeed. So I think that might be a latch problem. If it's a very newborn baby, then maybe we are still seeing you. There's the infant feeding team, there's the Oxfordshire breastfeeding support team. So there's people out there that can support. Breastfeeding shouldn't really be hurting you. So if there's a little tooth, congratulations, baby.
Yeah.
It shouldn't actually be impacting on your breastfeeding. So get in touch with us on that one.
Lovely.
Lovely.
Thank you. Don't know if we've got anything else to come on, ladies.
45 minutes.
Yeah.
No, I don't think
So,
we have
I don't know, anybody else that's still on, have you got any questions for us? As I say, we're at the end of the phone, and for those that you know, as I say, the phone is very, very busy. We only have one line, and we don't have the opportunity to leave a message if we're engaged. So we do appreciate how frustrating it is, but we just ask you to keep trying. That's all we can ask.
And look at all the other telephone numbers that you can get access to. If you're worried about your baby and you need somebody immediately, then get that help immediately. I think when we had COVID out initially, then I think a lot of parents were left in the lurch and it was very scary. And these videos are now providing a massive support for people. But we as midwives are still there.
Yeah.
And we still are able to provide as much care as we can given the situation. But we need to have that contact.
Charlotte's just come back just to confirm, just to say that her baby's very newborn, it's just over a week old. So, like you said, I think it's more of a latch problem.
Yeah.
So, if you are struggling, Charlotte, then please give us a buzz and we can sort of try and help you with that. And she goes on to say thank you. So, thank you, Charlotte.
Thank you.
So,
just Mel, before we finish, unless there's any other questions, just Mel obviously briefly said when we started, when you come to our office in Bucknell, or if we come to your home, we will be dressed in PPE, so we will be wearing a mask, we will have an apron on, and we will be wearing gloves, okay? So very similar to what you would have seen in the hospitals, it shouldn't feel much different to you. And when you come to our office, we do ask you to bring a mask with you to wear as well. If you can, please, that would be great.
and stay in your car.
Yeah.
We have quite a spaced out appointment system, so we usually know that if there's usually only one car around at a time. So please stay in your car and we'll call you and your baby in when we're all safe and PPE'd up.
When you come to us, we're very close to another farm in Bucknell. We're Lower Farm Barns, and you do need, if you're on the Bainton Road in Bucknell and you're going out towards Bainton, we're the last entrance on the right into quite a nice manicured farmyard actually.
Yeah.
But you go around a little bend and then you'll be into the middle of the offices. There's a manor farm on the left. Please don't turn into that. That's not where we are. And I think some Google is sending people into that farm. So do make sure that you turn. It's on the right as you go outside out of Bucknell.
Yeah. And it's on the Facebook page, so we have put a map on there and given you the instructions to find us, so that we don't keep turning up at that farm.
And there is a sign outside right by the gates in NHS Midwives. So if you are unsure if you're in the right place and you cannot see a sign saying NHS Midwives, you are in the wrong place. So just go forward a little bit more. Okay, so there's definitely a sign.
Right then, ladies, thank you very much, and thank you for that. Thank you, Oh, hang on, sorry, I've just got one more question. I just want to say, Rachel's just said thank you to us, thank you. And from Camilla, regarding the forms and the booklets that you've mentioned when you leave hospital, do you get these if you go to a birth centre instead of hospital? Yes, everybody provides you with the same information no matter where you birth. So yeah.
Even at home.
Yeah,
and
same
even
at
at
home. So you should get everything wherever you are. Okay. Well, we're going to say goodbye and thank you for watching.
Thank you.
Bye.
Bye.
George was very well behaved.
Oh, George was very well behaved. He's always well behaved.
He didn't cry or have